My name is Ryan Castleton, and this is my senior capstone. Per the instructions, we need to share our identification to make sure that we are who we say we are. This is my driver's license. This is my ID. I apologize, it looks like a mugshot, but there we are. Okay. So, like I said, my name is Ryan Castleton. I am a Dixie State University student in their RN to BSN program. I've been an RN for about 5 years with working in various departments. Okay. I've worked in the ER, ICU, PCU, floated to med surge sometimes, and I've been working as a staff nurse, a float nurse, and also a travel nurse, which I am currently a travel nurse in Las Vegas, Nevada. I live in Utah, that's my hometown, but currently traveling to Las Vegas. And so, this is our senior capstone, which basically encapsulates our entire learning process, okay, our entire learning and putting it into action into a project that is helpful for a facility or helpful for ourselves, okay. So we've done lots of learning of research and being research literate. We've been learning about leadership and how to lead in healthcare. And so this is an opportunity where we get to apply our learning, okay. So as mentioned, I am a travel nurse, and with that, I have floated to many different hospitals. I've seen a lot of different ways on how hospitals work, a lot of different policies, a lot of different procedures. One commonality that I've seen in almost all the hospitals is a need to refine or perfect the rapid response system. Okay. Now, even though the rapid response system or the rapid response team members are very well trained, the nurses, the doctors, right, and the hospital focuses their training on these people as they should, all right, which is fantastic, right, and they have the proper certifications. But a lot of the floor nurses don't have that same training, excuse me. And so my project is to help that situation, okay? There's a time frame between the time a code is called and the rapid response or code team arrives that is critical for not only the patient's outcome, okay, but for the floor nurses. And so my project is to simply train and give knowledge to the floor nurses so that they can properly care for the patient in that short time frame. Okay. How are we going to do this? First, I did research on the hospital where I'm currently at on what their current policy and procedure is. Right? I need to know what I'm dealing with. Second, I did research, right, on evidence-based practice. Okay, what is the profession currently saying about how to best apply these principles on rapid response and code blue teams? Okay, and then third, collaborate with the different leadership of the hospital and figure out what is needed to be done in that time frame, and then we develop a card, okay, which is just a badge card that you put with your ID badge and carry it with you wherever you go on what to do. On one side, there's a rapid response list, and then the other side, there's a code blue list. Okay, these are distributed throughout the hospital to each employee, so they are better equipped to deal with an emergent situation. That's my project. Okay, so the perceived benefits to the organization for this project are: one, improved patient outcomes, okay, and patient safety. Okay, this is, of course, this is the main focus of many hospitals. Okay, and and then as well as properly trained staff. Okay, I want to give the staff, I would like to give all the staff the same training that the rapid response team gets, but it's step by step. Okay, this way we can hit the most people in the um, in less time. Okay. Now the purpose of the practical goals. Okay. One is to, like I said, improve patient outcomes and patient safety, but also is to give floor nurses a peace of mind in knowing that they always have with them instructions on what they need to do in case, in case of an emergency. Okay. Then the last preceptor selection. Okay. So as I had mentioned, I am currently in Las Vegas doing a travel assignment. My assignment started about the same time that the semester started. And so I'm coming into a hospital that is brand new to me. Right? I do not know a single soul in the hospital. Therefore, I needed to select my preceptor very carefully, right? Having not knowing anybody. And so after I met with a few people, I decided to ask Amber Quinn, who is the IMC manager and also the director of rapid response, to be my preceptor and my mentor. And she was so excited. Okay, she was so excited to help, and her personality just helped the entire project. She's very eager to help, and in fact, our first meeting, she went and grabbed a couple people. She just left her office and came back with a couple people saying, "Hey, these guys can help us. Let's do it." So she was fantastic, and I'm glad she was my preceptor, and I appreciate all of her help. Okay, analysis of the project. All right, so including the environment, adjustments, and difficulties. So the environment, like I said, is a level 1 trauma center here in Las Vegas, Nevada, and it goes throughout the entire hospital. Okay, even though I'm contracted to work IMC and float, we did rapid response and code blues throughout the entire hospital. Okay. Adjustments. There were a few adjustments that needed to be made, and with that, a few difficulties. There were a few little things throughout the project, of course, and you just roll with the punches. That is to be expected. But there were three main difficulties that we had to overcome. One is the fact that I didn't know the hospital or anybody in it. Okay, even though it was doable, it was just an added stress and an extra thing that we had to overcome. I had to learn the policy, get familiar with what their procedures are, and I had to get to know very quickly who were the important people I needed to talk to, who were the leadership that could make change and could give me proper information and input on my project. Okay, so that was number one. Number two is the same as I believe we are all experiencing during this pandemic, is COVID-19. Just working with the isolation, the different restrictions, less in-person meetings, and then of course just the added stress on the nurses in the hospital in dealing with the pandemic. So that was number two. And number three, that was unique to my hospital, was there was a cyber attack, okay, that resulted in paper charting. We didn't have any computers or phones for 3 weeks. Okay, it was on the news. It was for a mother hospital, all UHS facilities, or a lot of UHS facilities, but my hospital is one of those. And so we reverted back to paper charting. All right, this included everything from doctor's orders to medications to vitals, absolutely everything was paper charting. Um, and so it was very difficult. A lot of the nurses had never paper charted before, and in a hospital that is used to having things streamlined and all computerized, um, it would put a lot of stress on a lot of people. Everybody was picking up extra shifts, and all of the leadership were stressed and overworked, and so that also put a little bit of a damper on my project and delayed it a little bit. But we were still able to do it, and I'm grateful for all those that helped, especially the preceptor. So like I said, I collaborated with my preceptor a number of times throughout the project. We had probably about 4 or 5 meetings, I believe, in person, and then, of course, texting and emails back and forth a lot. And so that was very helpful. Okay, and so I explained my project a little bit. This is the card, or the contents of the card. Like I said, there's a rapid response side and there's a code blue side. This is the rapid response side. Okay, so this is unresponsive with a pulse. All right, it gives just a few simple steps, okay, of things that they need to do, all right, in case of a rapid response. So we need to get a set of vitals. We need a screenshot of their current status, patient status, and we want to set it to cycle if possible, right? So we can have an updated patient status. Okay, we need to assign someone to get a blood glucose. Okay, and we need to assign someone. All right, we don't want the primary nurse running off. Okay, to do the blood glucose, someone needs to come in and do it. And at least at the hospital I'm currently at, they're really good about that. All right, someone comes running in when they hear a rapid response with the glucometer and gets it right away. So that's good. One of the biggest things, all right, is we want the primary nurse in the room, right, with the computer in the room and the patient chart open. Okay, this helps so much. Okay, because every other person there doesn't know this patient. Okay, they don't know their baseline. They don't know why they came in. They don't know they're attending. All right, so the primary nurse who has received a full report and has called the rapid, okay, they need to be in there to answer questions. Okay, they need to be in there to give insight as to how to help this patient. And we need to have the computer in the room. So if the computer is already in the room, or they need to bring the WOW in, they need to have it in the room with that particular patient's chart open, so that we can place orders, we can look at labs, we can look at doctors. All right, we can have all that information right there. We also need to have the crash cart outside of the room. That's just a precaution, okay, in case things deteriorate quickly. And then we also need to have the charge nurse in the room, okay. They are a great resource to delegate, okay, other tasks. If it's the primary nurse's other patients, if it's the glucometer, or if it's designating a runner, whatever the case may be, the charge nurse needs to be there. And so they've also asked that the primary nurse knows these 3 things: the reason for admission, the attending doctor, and why rapid was called. Okay, in the many rapids that we did throughout my project, it was surprising that a lot of nurses didn't know these things. Okay, so it's important that we pay attention, okay, to these things. Okay, that's rapid response, and next is code blue. Just to give you a little more insight with my project, as I mentioned, we met with a number of different rapid response team members, leaders, educators, the whole gamut. But we also actually went to code blues and rapid responses during the project time frame. So many hours of this, and in this situation, I wasn't an employee. I was a student, or I was there just to evaluate. Okay, sit back and watch what happened, which was a great opportunity. I learned a lot from doing so. Okay, so this is the code blue. So this is unresponsive without a pulse. Obviously, we need to check for a pulse. We need to activate the code blue. We need to start compressions. And then we need to place pads on the patient. In talking with the rapid response team members, this was one of the most important, okay, and most missed, okay. A lot of times the rapid response nurses will come in and the pads aren't on the patient. They don't know what kind of rhythm that they're in. They don't know, how the compressions are doing. We don't have a snapshot of what we need to do, okay, when we get into the room. So that is one of the biggest things. Just as if you were out at the grocery store or at the gym, they have AEDs, okay. Just as you would help somebody with an AED, you would in that type of situation. Get those pads on, hit the analyze button, and it will talk you through what needs to happen. Okay? Very simple until the help arrives. Okay? So just as you would do it at, like I said, a gym or a grocery store, you would do it in the hospital. Okay? And then one side note, okay, as you can see here, okay, there's a certain way to roll the patient. So I'll just quickly go over that. First, we need to roll the patient on the side and put the back pad first, along with the slide board, the back board, okay, and then turn him back over in the supine position and place the front pad, okay. This helps so that when a lot of the time people put the front pad on first, okay, and when they turn the patient, it actually folds the pad or slides off or moves, okay, which isn't ideal, of course, okay. And the other big thing that they asked, is a working IV. They need a working IV to properly give the medications that are needed in a code situation, okay. Okay, so the evaluation of the project, achievement of goals. I was actually very pleased with the outcome of this project. We achieved all of our goals. Not only have we seen improved patient outcomes in the few that have been affected by the project. Of course, this is a project where its outcomes results over time, but we have seen improvement there, of course. And then we have also seen that the primary nurses, the floor nurses, have that peace of mind, okay? They're better trained and they know what they need to do, right, in an emergent situation. So that was one of our goals. Another goal that I did not anticipate but makes sense is better teamwork and better camaraderie between floor nurses and rapid response and code nurses. Code nurses and rapid response nurses are extremely grateful for this opportunity in this project. They had little, or not often did they have people ask them, okay, what needs to happen? What would you like to have happen before you get there? And so they were very appreciative and very happy with the project. And in discussing and giving this information to the floor nurses, the floor nurses and the rapid response team, they better work better with each other and have better teamwork. So that's an added plus of the project. Benefit to the organization, okay, we kind of already mentioned that, but better teamwork, all right, better morale, more comfortable and trained nurses, and then better patient outcomes and patient safety. Okay, so the benefit of my project to my professional growth, okay, it's actually been a great opportunity that I've learned a lot. Like I said at the beginning, it's an opportunity to to put into practice the things that I've learned during the RN to BSN program. Okay, it is so important to have technical RNs, okay, that can actually perform patient care and do a good job. But the RN to BSN program allows you and gives you the education, the knowledge, and tools and resources to make a difference in the policy and processes of the nursing profession and move it forward, continue to improve, okay? And so that includes research, that includes learning, that includes leadership, that includes processes, includes so many things. And so for my professional growth, it has taught me that I don't need to complain to someone else that something needs to happen, or I don't need to report it to somebody and wait for a result, hopefully. Okay. I have learned that I have those tools and resources and knowledge to make a difference. Okay. I saw a need, and so I did something about it. Okay. I made it happen. Okay. Which is great for me in my learning. I plan to go on and be more on the administrative side of nursing, and so this is a great opportunity for me. The next is the self-evaluation of leadership skills. Okay, I've been fortunate enough to have lots of leadership positions in the past, which I'm very grateful for, but I've also learned a lot in this project. I've learned that I need to, like I said, make it happen. I can't wait on anybody else to hopefully do what I'd like to have happen. But I need to be proactive. And so when I enter into a meeting, I need to be educated on the topic at hand. Okay, I need to be confident. Okay, and with that confidence and with that preparation, okay, it demands respect. Okay, in a professional situation and scenario, right? If you give respect, or you also get respect in return. And so I was fortunate enough to have done that research, have done that education, and come into these meetings prepared and give a solid look and snapshot of what the project is and its goals. And with that, I was able to get a good outcome. I received a lot of support, a lot of help, and excitement, to be honest. And so it was a good experience overall. Okay, conclusion. Summary of the project. Like I said, it was a very good experience. It allowed me to put into practice a lot of the things I've learned in the RN to BSN, but it's also taught me that I have a lot to do, and I can do a lot. I have a lot to offer, and then I also realized that with this project, and I'm sure all of the other projects, it has made you want to do more projects. It has made you realize that there are more things that need to be done, or more education, or that we need to perfect this, or we need to refine that. And so even with this project not being completely resolved but improved, that just opens up 10 more things that I'd like to do. Okay. But overall, the project was a success. All right, from the beginning to the research to the end of the evaluation and implementation of the project. So how will the project influence students' future practice? Personally, okay, I learned a lot learning about these code situations. And so I have learned what to do, what not to do in those situations. I have learned what the code nurses need. And so personally, I will, of course, do those things, and I will make those few adjustments that I need to make personally as a nurse to better help them and better help my patients. So that's personally how it will influence me. And nursing as a whole, I think it will definitely help nurses, like I said earlier, feel more comfortable in dealing with an emergent situation, but also um, they will give better patient care. Okay, this will affect on how they uh, go about doing their job, and so this education um, moving forward will help nurses and patients. Okay, so and I hope to continue perfecting and refining that process. Okay, so that's the end of the PowerPoint. In conclusion, I just want to thank all those that helped with this project. A special thanks to Amber Quinn, okay, who was my mentor, helped in so many ways, and she was absolutely fantastic. I want to thank all of the other students who also helped with this project with your responses to the discussions and all of your hard work as well. I want to thank Dixie State and our professor for giving us this opportunity and giving us the education and tools we need to be successful in our field, but also to progress the profession of nursing. So thank you for watching, and thank you for the opportunity.